This video will review BVM Mask Application and introduce a new method. The new method will be called the TE method versus the original EC method. First, let's review the EC method. The name simply comes from the way the hand is shaped. The C, which holds the mask, is formed by the thumb and the index finger, and the E is formed from the middle, ring, and pinky fingers for the mandible. The updated method, the TE method, which really is the thenar eminence, which as the photo shows here is just the meaty part of the hand. I'd like to introduce a memory tool. Think about it as the thumb E technique, where the thumbs will control the mask seal, and the E will be updated to the index middle ring fingers versus the middle ring pinky finger for control of the mandible. A demonstration will come later in this video. So the reasoning for changing the technique, have lots of studies on this, but one that I found I think demonstrates it the best, so we'll just read these. The TE grip provided greater expired tidal volume, 379 versus 269, with a mean difference of 110 mLs. Next, there was no significant difference in pip values using the two grips. The TE mean was 14.2 and the EC mean was 13.5. Okay, we're going to review the BVM mask seal. First, we'll look at the original CE method that we all learned in school, and then I'll show you the new TE method. So if this first part is the same for both, it's placing the mask on the patient's face. So we want to make sure that the entire face is enclosed, as well as creating a seal. So kind of show you the problems with that if you're not careful. If you're too high on the bridge of the nose, more towards the forehead, the lips or the corner of the mouth will be hanging out, and that won't create a seal. If you're too low, the nose will raise the mask off the patient's face and will break the seal there. So you kind of have to find the sweet spot. Generally speaking, it's in the base here where the forehead and the nose slope together. You grab it there, and then you'll see that both corners of the mouth are inside the masks. And then so review the CE method. So we were taught us to do C's here on the top and then E's to grab the jaw, mandible rather, and you would do this and open the airway. The problem with this is you actually have poor control of the mask seal with the C's, and you're using the weakest fingers to control the jaw, which actually has really strong muscles. So the TE method, which is the thumb and then E, is instead of using the weak fingers, we're going to use the strongest one. So index ring or index middle ring fingers, and the thumbs actually create a really good control with the seal in all directions, and then you have the strongest fingers to open up the airway. If the TE method is new to you, you have to practice. Competence comes through repetition. The first time that you're doing this should not be on a patient. I think it's reasonable for the first couple of months, come on shift and just get hands-on. You just need a dummy. A couple of minutes in the beginning of a shift just to try out the new method to make sure you get it. I think ultimately it will lead to better care for our organization and better outcomes. This concludes the BVM Mask Application video.